I'm taking care of Patrick Wilkinson today. He is a male. His birth date is 8/28/1967. He has no known allergies and he has a full code status. So the first thing I'm going to go look at is his MAR and see what is ordered for him. I see that cyanocobalamin is ordered, 100 micrograms. We are giving this daily and we are giving it subcutaneously, due right now. Because this is a subcutaneous injection that we are giving daily, I want to make sure that we are not using the same site as last time, so I'm going to check where his last site was, and it looks like it was on the right side of his abdomen, lower abdomen, so I'm going to be giving it to him on his left side. Next thing I'm going to go look at are his vitals. His heart rate is 102, his blood pressure is 156/84, his respirations are 22, his temperature is 98 degrees Fahrenheit, his SpO2 is 94%. Next I'm going to check and see, he doesn't need to eat with this medication, but I might as well check. That's fine. Okay, so with this drug, we need to make sure that he has some labs drawn. So we want baseline reticulocytes, erythrocytes, hemoglobin, hematocrit, vitamin B12, and serum folate levels. And then within the first 48 hours of receiving this cyanocobalamin, we want to make sure that he has potassium levels. And he has. So we are good on that. Now I'm going to go back to his MAR and see what is ordered for him. So we have 100 micrograms, and what is available is 1,000. So we're going to divide that by 1,000 micrograms times 1 ml. I'm going to do my math on that. I have 100 divided by 1,000. That gives me 0.1 mLs. Now I can perform my hand hygiene. And I'm going to rub until my hands are dry. And I'm going to grab my tray. Take my keys with me. Okay, I need 2 alcohol swabs, one for my vial, one for him. I need a 1 ml syringe. And I need a 5/8 inch needle, and it's a 25 gauge, so that's within range for this subcutaneous injection. Now I'm going to grab my it is vitamin B12, but my cyanocobalamin. Close it, lock it. So I'm going to perform my first medication check now. So here is my cyanocobalamin. My vial is completely intact. It is with an expiration on 8/2027. That's when it expires. So I'm giving this to Patrick Wilkinson. I'm giving him cyanocobalamin. I'm giving him 0.1 mLs. I'm giving him this daily due right now, and I'm giving it to him subcutaneously on the left side of his abdomen, and I will document this later. So now we are good to go into Patrick's room. Knock, knock.
Come in.
Hi there, Patrick. How are you?
I'm doing all right.
Oh, okay. Well, my name is Sarah. I'll be your student nurse today.
Okay.
I'm going to perform my hand hygiene, rub until my hands are dry, provide privacy. Okay, Patrick, I just need you to confirm your full name and your date of birth for me.
Yes, my name is Patrick Wilkinson, and my birthday is 8/28/1967.
Okay, so next thing I need to ask you are about any allergies. So do you have any allergies to any latex, betadine, iodine, any foods, anything in the environment, any medications, or any adhesives?
Nope.
Perfect. You seem like you're a little bit tired today.
Yeah, I am a little bit tired.
Have you been tired frequently?
I have. Weirdly enough, I've been tired for like 6 months.
Oh my gosh, that's a really long time to be feeling tired.
It is.
Does it ever make you dizzy?
When I get up, sometimes.
Okay. Have you recently started this cyanocobalamin?
Yeah, a nurse came and gave me a shot yesterday.
Okay, so that should help with your energy levels. We will go ahead and reassess, once it has kicked in, but it will help you. I'm going to go ahead and lift up the head of your bed. Okay, I'm just going to go ahead and show you where your site will be, if that's okay.
Yeah.
Okay. So, I'm going to locate the bottom of your ribs. I'm going to find the top of your iliac crest, and we're going to go in the middle of that. And then I'm going to go at least 2 inches away from your umbilicus, which is your belly button, and we can go anywhere in this area. So I'm going to place this here. I'm just going to cover you up a little bit so you're not as exposed. Okay. I'm going to scan your wristband. I'm going to scan my medication. So I have cyanocobalamin. My vial is completely intact. There's nothing wrong with it, and it is with an expiration date. I'm going to do my second medication check. So this is for Patrick Wilkinson. He has no known allergies. I'm giving him cyanocobalamin. I am giving him this daily, due right now. I'm giving him 0.1 mLs or 100 micrograms. We're giving this subcutaneously on his left abdomen, and I will document this later. So I'm going to perform some hand hygiene. Rub until dry. Okay, so I am just going to open up my alcohol, pop off the lid to my vial. I'm going to pull my alcohol out, clean my vial without contaminating it. Next, I'm going to open up my syringe and my needle. Going to twist this on, pull back my safety, pop my cap off. We're going to save this. I'm going to draw back 0.1 mLs of air and inject this into my vial. I'm going to flip it over and draw this up. Going to scoop my needle. Okay, make sure there's no air bubbles in there. Okay, and I'm at 0.1 mLs. Okay, next I'm going to perform I'm going to perform my third medication check. It's always good to do some extra hand hygiene though. So I have Patrick Wilkinson. He is getting cyanocobalamin. He is getting 100 micrograms or 0.1 mLs. I'm giving this to him daily, due right now. And I'm giving this to him subcutaneously on his left abdomen. And I will document this later. Okay, now I can go ahead and do some more hand hygiene. And I want to make sure I am rubbing my hands until they are dry so I can put my gloves on. Now I can go ahead and clean my site. We already identified where our site is going to be, so I'm going to clean from the inside out. And I'm going to make sure that this dries. I'm going to go ahead and grab my needle. Okay, my site is dry. So I'm going to pinch his abdomen. I have about 2 inches of subcutaneous tissue. So therefore, I'm going to go in at a 90-degree angle at a darting motion. You ready, Patrick?
Yep, I am.
1, 2, 3.
Ow!
I'm sorry. I'm going to inject this slowly. Okay, hold for 10 seconds. It's been 10 seconds. I'm going to pull this out, activate my safety. I'm going to throw this away. My site is looking good. There's no bleeding or any of that, so I can go ahead and cover him up. I'm going to remove my gloves. Perform hand hygiene. Okay, Patrick, I am going to go ahead and just lower you down. So there are a few things that I want you to be aware of after I just gave you this injection. So I'm going to encourage you to eat some rich food sources of B12 that are added to breakfast cereals, vitamin B12, or have vitamin B12, soy milk, organ meats, clams, oysters, egg yolks, crabs, salmon, sardines, mussels, milk, and dairy products. And you just want to watch out for pulmonary edema. We will listen for that, but if you have any troubles breathing, please let us know. So that is all of that. I'm just going to make sure that your bed is locked. You have your call light. I will give you your personal belongings in a minute. So I gave you 100 micrograms. I gave this to him in his abdomen on the lower left. He tolerated it well. I'm going to update your chart. I will reassess you in a little bit. I'm going to dispose of my medication properly, and I'm going to give him his personal belongings. Here's this. Okay, Patrick, you go ahead and call me if you need anything. I'll come back and check on you in a little bit.
Okay.
Have a nice day. I'm going to perform some more hand hygiene before I leave also. Sorry, Patrick.
It's okay.
I'm almost done. Okay, rub my hands until they're dry.
Okay.
Now I will be on my way. Bye, Patrick.
Bye.
I'm going to go document now.